Hi, I'm Dr. Beltre from Beltre Bariatrics. I'm going to make a quick video talking about the Bari Clip because it's a very interesting procedure, and some patients still kind of ask me about if I do them. I don't do Bari Clips, just so that you guys know, but I figured I'd do a quick video explaining it because some people are looking for Bari Clips so they can understand what it is. The Bari Clip basically is a silicone clamp, if you will, that is kind of placed lengthwise on the stomach. So therefore it reduces the stomach in size without cutting or using any stapling or rewriting intestine like you do in a gastric bypass. Essentially, the Bari Clip tries to mimic or imitate the gastric sleeve by placing the silicone band across the stomach. It can be removed if necessary. The Bari Clip was first introduced in 2009, kind of became popular in 2019, and then is still fairly known primarily outside the United States. I don't know any bariatric surgeon in the US that doesn't, but it is done outside the United States, like Mexico and places like that. But it is one of the newer bariatric procedures, if you will. The advantage of the Bari Clip, well, it is reversible, so it can be removed if there's complications or anything like that. It is minimally invasive, so it's done laparoscopically the way we do all the bariatric procedures. There's no stapling or cutting, so therefore surgical risk is reduced somewhat. And it promotes weight loss. It works similarly to a restricted procedure, meaning procedures that have a small stomach. That's what restriction means. You are restricted as to how much you can eat. So this is a restricted procedure, allowing you to eat much less and therefore causing weight loss. Who's eligible for the Bari Clip? Well, same thing as any bariatric procedure. You need a BMI of 30 or above. For those with lower BMI, you will need obesity-related illnesses like type 2 diabetes, high blood pressure, things like that. Risk and potential complication of the Bari Clip, well, it is generally considered safe. So it's a fairly safe procedure, but it has some potential risk, including nausea and vomiting. Nausea and vomiting with the Bari Clip it's common the first couple of weeks. Bypass patients, sleeve patients can have nausea, vomiting, usually for the first couple of days though. With the Bari Clip, it's seen longer. You can have it for a week or two because it is a foreign body and your body kind of needs to get used to having that there. This nausea, vomiting can lead to dehydration. There can be stomach obstruction from stomach folding or tissues folding because again, this is a foreign body. Our body will try to isolate it somehow, form scar tissues around it. It can kind of bend the stomach and cause obstructions and things like that. It can lead to acid reflux. There's leaks from the sutures that are used to hold it in place, although that is very, very rare. And then again, there's a weight regain if lifestyle changes are not maintained. So, very easy to cheat around this procedure, I believe. So you have to be careful with your post-op dietary changes and things like that. And then, of course, there's potential for slippage or movement. Again, it's a foreign body. The stomach, it's a muscular tube that kind of moves around, and therefore it can move this silicone band out of the way, and the stomach size increases now, and you can eat more. Recovery, very similar to any bariatric procedure. It is done laparoscopically. It's done as an outpatient. So recovery takes 1 to 2 weeks. Patients should gradually transition from liquid to soft and then to normal diet within 4 to 6 weeks. Again, healthy eating habits, physical activities encouraged once recovery has occurred. Long-term success, well, the Bari Clips can result in 30 to 60% of excess body weight. What does excess body weight mean? It means that if you weigh, for example, if you are 100 pounds overweight, you can lose anywhere between 30 to 60 pounds with the Bari Clip. The amount of weight loss, of course, depends on several factors, including your diet, lifestyle. It's very important that you follow a very healthy lifestyle with this procedure. And of course, your starting weight. The more weight you have to start with, the more you're going to lose, obviously. And then, of course, compliance. You have to be very compliant with this procedure to achieve more weight loss. Who should consider the Bari Clip? Well, this is good for individuals that want less invasive weight loss surgery, that do not want a permanent removal of stomach tissue, and are looking for a potential reversible procedure. I think those are the ones that should consider the Bari Clip. Disadvantage of the Bari Clip, in my opinion, one of the disadvantages is that there's no removal of gastric fundus. The fundus is this part of the stomach here. which is removed during a gastric sleeve or is bypassed during a gastric bypass. The fundus is the part of the stomach, of course, that stretches so you can eat more. Also, there's a hunger hormone called ghrelin that is made there that makes you hungry. So therefore, since we are not removing that part of the stomach, the fundus, there's potential issues with maybe hunger that you will experience more with the Bari Clip versus other procedures. There's potential disruption of the stitches leading to increase in the size of the pouch, and you can eat more and therefore weight regain. There's less sustainable weight loss over the years, over time, meaning that even if you do really well with weight loss, a lot of the patients tend to regain the weight over the years. And it's not as widely studied as any other bariatric procedure because it's very new. So therefore, being that it's so new and we don't have that much data on it, it is not approved by the FDA. So that's very important. It's not an approved procedure by the FDA. And it's a foreign body. And really, we do not have a very good track record with foreign body in weight loss surgeries. I mean, back in the 80s, we used to have a little band, non-adjustable, that we used to place in the middle of the stomach there. And this was a foreign body, of course, and this caused issues with slippage, with obstruction, acid reflux, weight regain. So we stopped doing those. These were very popular in the mid 80s. Then, of course, that became the lat band, which is an adjustable gastric band. Same issues, very popular in early 2000. By 2005, the band was the most commonly done weight loss procedure, but again, caused the same problem: slippage, moved around, obstruction, acid reflux, strictures. Weight loss was not as great. Weight regain was pretty high. So the band, the lat band, kind of slowly being abandoned, and now we are with a Bari Clip. So still the jury's out. We'll see what happened with this procedure over the years. I can tell you though that we seem to be getting a little better each time we come up with a foreign body to use as a weight loss procedure. The band was better than the first ring that we developed, and then the Bari Clip may be better than the band. We'll see. So that is the Bari Clip. I hope this video was helpful for those that like to learn about bariatric surgery, that are thinking about having one, that are still looking and comparing. But hope this was helpful for you guys. Again, this is Dr. Beltre from Beltre Bariatrics. I'm a bariatric surgeon in the area of Orlando, Florida. Thank you and take care.